Hey, Ange.
Hey Les, how's it going?
It's going well.
Good.
I'm excited to come on in today.
That's your natural state.
Yeah, you're right. My natural state is I'm
I want you
baseline
to come on and
excited.
like be like sad,
Like
not
Eeyore.
sad, but
Like-
yeah, like Eeyore. I want you to be like, I don't know. It's kind
Here
of
we are again.
just
Another episode.
another episode. I
Then
do
then
not
they
want
then
that.
they would really say, "What the heck has gotten into Les?" So welcome to another joyous episode of Black Boomer Besties from Brooklyn.
I'm Angella, and that's Leslie, my best friend of almost 50 years. We are two 60-something-year-old women who have decided, we've committed to live lives that are more bold and joyful. And we invite you to come along with us. So today, we have Dr. Toni back. We're going to be, it's another episode in our year of the menopause series. And we're going to be talking about, no, let me fix that. They're going to be talking about menopause and cardiovascular health.
You're going to talk to.
I'm going to be poking at them. I'm going to be like, what the hell does that mean? I don't understand this doctor talk. So I'm going to represent the people, power to us. And they're going to be, Dr. Toni's going to be giving us some insight about the connection between menopause and cardiovascular health, which is something that we rarely hear about. And so before we get started, Leslie has something to ask.
So I already know you like our content. So I'd love for you to hit like and subscribe and turn on notifications so that you can find out when we drop new content, typically about once a week, but you want to be in on it when we drop new content. So please hit like and subscribe right now.
Thank you.
And before I let Dr. Toni in and introduce herself again, what I want to say, Ange, is we don't want any barriers between people who are physicians and non-physicians, because one of the things that I stress to my patients, and this is something that's newer in the medical arena, but it's no longer the age of where physicians are telling patients what to do. We want to continue a dialogue. We want it to be a back and forth, and we want really collaboration, because those are the types of behaviors and relationships that foster collaboration, compliance, questioning, and things like that. So you may be power to the people, but we the people too.
I get it. I'm just saying. Before I let this point go, I'm just saying that oftentimes doctors they desire that, but you live in a doctor world. You live in a, especially when you two start kind of,
and so getting in the weeds.
Yes, I know it's not your desire to create barriers, but I'm just here in case you slip up.
Okay.
And just
thank
help
you
to,
we bring to you Dr. Toni Otway.
Hi, everybody. Thank you for joining. And thank you for inviting me back. I'm Toni Otway. I'm board certified OBGYN. I no longer practice OBGYN anymore, but I do work for an insurance company. I'm a utilization reviewer in the state of New Jersey. But these kind of discussions are still always dear to my heart, and trying to educate the masses on health and how it relates to women especially, and women of color especially too. So
well, good. So you've decided to, under the umbrella of the year of menopause, specifically talk about the cardiovascular manifestations or effects. In other words, your heart and your blood vessels, and how that period of menopause affects those organs. Right. Before you do that, let's just remind our listeners, what is menopause and why does it matter?
Okay, so just a reminder, just to go over a few things about menopause. Menopause is that period in your life when your ovaries are no longer functioning. Basically, our ovaries are meant to function to produce children, release eggs. and it's a function of childbearing. So once your ovaries are no longer releasing the eggs, because you are born with a finite number of eggs to be released over a number of years, once they've all been exhausted, then you go through this period of time called menopause. So your hormonal changes that help to control this whole function suddenly starts to drop off. And there's perimenopause, which is the time that the function of your ovaries is starting to slow down. And that's the time when you see changes in your periods and other things that would that go on. And then menopause itself, you can truly call yourself menopausal when you've been a whole year without your periods. So and then you become in the postmenopausal state. And I have said before that your estrogen really makes you who you are as a woman. You have over 400 receptors in your body that estrogen affects, and it goes all the way from the top of your head to down to your toes and everything in between. So estrogen is a huge factor in your body functioning as a woman. So that's it in a nutshell.
I have thanks for that. That was really clear. So it reminded me that my sister-in-law some years ago did not have a period for something like 350 days.
That's cruel. Yes.
and then here it comes, right? And so according to this definition, she was not menopausal, but it seems kind of arbitrary to me.
Right.
Can you talk to that and why it's kind of how it came to be this kind of rigid in terms of definition, this rigid line between when you are and when you're not?
Well, I think that the way they look at it is that even though, when she got that period, it may be that she had an egg that was released. So that is still showing you that your ovary still has maybe one or two things left, even though a pregnancy probably wouldn't have come about because your eggs are so much older now. Got it. But it's still showing that your body is still producing that level of estrogen that could produce whatever follicles or eggs that are still there. Okay. I must stress that if you are coming up to 300 and something days and then all of a sudden you have a period, I would encourage people to go and see their physician, because sometimes an irregular period can also be a sign of other things too. So don't just think that just because you're still getting one or two, that it's normal, it's fine. Sometimes there are issues that can occur that can have you to still have a bleed that you shouldn't really be having. So if you've gone a period of time and then all of a sudden you get one or it starts coming back full-fledged again, you should really just get it checked out just to be sure that it really truly is nothing other than, you still going through your changes.
I see.
And those changes can take, it could take a year, it could take a few years. I know people that have been going through those irregular things for a few years and still hasn't stopped. And so everybody's different. So it's all about getting to know what your body is like.
That's right. That part. Someone mentioned just before we started recording that they were having a hot flash. So I'm not calling any names.
And that's boy, but the one that has the tissues all the time, like stuck to her face. I wonder who that is. But and that also reminds me. Let's just I started, I would say, menopause rather late. I think over 60.
Wow.
When I, stopped, but I'm sure I was over 60. But what I'm wondering is, and before we get into the cardiovascular part, like the symptoms of hot flashes and stuff, do they last very long? Or is it like when the the actual egg release or the bleeding stops should the discomfort and the sweating and the flashes stop, or is that also a continuum? That
can also be a continuum. That can also be.
Yeah.
I personally
Darn it.
never experienced anything. My period just stopped. That was it, and I
Wow.
didn't have any symptoms. Nothing.
That's
and
not
I did.
fair.
I did have one period. I did have one period, almost a year to the day of my previous one, and that was it. Done.
And then it was
So
so long.
Yeah, I never ever had any issues.
Wow.
And then I have people who have had periods, they stopped their periods years ago and they're still having issues, hot flashes. So everybody's different. And
I
it's,
see.
still need more studies to figure out why. But,
Sure.
and, in this day and age, who knows if that's even going to be possible to even study anything anymore. So, but yeah, it varies. Different people have different stories. So
Yeah.
All right. Different stories. Yeah, that's a good way to say it.
So you mentioned that menopause has the body has receptors for estrogen all over the body, and because we're specifically talking about the heart and the blood vessels, tell us about some of the things that a person being in menopause, what kind of changes might her heart go through?
Okay. So the issue with cardiovascular disease, and that's what we're going to talk about. And I just wanted to add something because, I was going to speak about, maybe a woman going to the doctor and saying they have this, that, and the other symptom. But then I don't know if you know Anne Burrell, the chef on Food Network.
She just passed away yesterday. She was 55 years old.
Yes. And now they've come to find out that they think it might be she had a heart attack. So
Wow.
I just want to say that, heart disease is actually the leading cause of death in women. It usually occurs later in life than men. Men on average might see heart disease at around 45. We usually start to see it around 55. And cardiovascular disease, the CDC has come out with the percentage that women over 20, there's about 6% of women over the age of 20 that start to show signs of cardiovascular disease.
Over 20?
At over 20. There's 6% of women are starting to show those signs.
Wow.
What is cardiovascular disease? Basically, it's primarily the buildup of plaque in the arteries. And it's also called atherosclerosis. It's called peripheral artery disease. It could be called heart muscle valve disease. There's a whole different lot of words to describe it. Basically, it's just this buildup of plaque inside your blood vessels that over time starts to narrow the blood vessels. And this is the issue. It narrows the blood vessels and the flow of blood is decreased. So it's not something you can actually see. We know it happens, but you can't see how bad it is in you. And usually the first sign of a woman having cardiovascular disease, most of the women, usually the first outcome is because of a heart attack. So Anne Burrell probably had cardiovascular disease, probably didn't have any of the normal signs or symptoms, or didn't do any preventive measures, or and then this is the first sign of us knowing that she had cardiovascular disease, is that she had a heart attack. And this is what happens to women.
Wow.
It's usually the first sign of cardiovascular disease in a lot of women is we have this heart attack. And by saying that, we have the worst outcomes when it comes to heart attack. We tend to ignore.
That's what I was going to say.
signs.
She may have had signs and said, I have
just ignored
heartburn.
it.
Because I
Exactly.
always associate heart disease with men for some reason. I'm not sure why that is, but that's my go-to. And the other thing is this related to cholesterol? And I know that's what affects the closing of the...
We'll get into that. It is related to that. Okay. So, what was my thought?
I think it was interesting that you were saying that she may have had symptoms that she may not have associated it with being a problem in her heart. But then again, we all also know that the medical profession, we are taught that especially in a 55-year-old woman, sometimes these symptoms of heart disease present differently than they would in men.
Absolutely.
Men may come in, looking perhaps overweight, like they should have some heart disease. And then you think, well, if you're having chest pain, let me do a workup. A woman may come in, she may not be overweight or obese. She may not have the typical risk factors. Or she may have, I just have some jaw pain, this, or there's something going on, or every time, just a little, the symptoms can be very vague, and very often it can be missed.
Exactly. And I think that we downplay our symptoms as well.
Because we're busy.
Because we're busy.
We got making lunch for the kids.
Absolutely. And then we wait longer to seek help, to think that maybe this is something that's wrong with us, or because we just kind of poo-poo our symptoms a lot. So some of the risk factors obviously are, some of the old associated risk factors are diabetes, smoking, obesity, overweight, physical inactivity, high blood pressure, and abnormal lipid levels in your blood, which are the fats, the LDL, the HDL, the cholesterol, abnormal. So some of the newer risk factors that they have been finding are also things that may even happen in pregnancy. If you have a pregnancy that has, you have gestational diabetes, or you have high blood pressure, or preeclampsia, or you have preterm labor, or if you have depression, breast cancer treatment, and even early menopause, these are all things that can increase your risk, which are things that they never used to think of before. Right. So imagine all these women that are having these issues in pregnancy. These are all risk factors for you to have cardiovascular disease. So,
and then how many physicians 20 years later would ask, tell me about your obstetrics history, tell me about your pregnancy. Right. That was remote. My kids are grown. I don't, what do I remember about when I was, pregnant 20 years ago? Was my blood pressure high? I don't know. Did I have diabetes? I don't remember. Wow.
Yeah. So some of the typical symptoms that, have is the chest pain, which in women is not necessary. Normally you hear men say, they feel like an elephant is sitting on their chest, or there's this pressure. It may be different in women. It may be more of, just like a little pain or a little discomfort. Whereas with men, they describe this thing as, somebody sitting on their chest.
Wow.
Maybe you're short of breath, and you probably put that down to maybe I just walked some stairs and stuff, or just walked a little further than normal. Things like extreme fatigue. I mean, which woman is not fatigued?
I'm always tired.
This is actually what I was thinking, and that's why I was chuckling a little bit, because you've seen those videos where they put an apparatus on a man to give him the sensation of period cramps. Right. And they're like on the floor, just cannot take it. And it's something that most of us just go through.
Most of us just keep walking, just keep going.
And so I'm wondering if women, just by the nature of our physiology, whether we have a high threshold for pain, not only pain, but discomfort.
Right.
Absolutely. And that would then put us in this risk factor. And then, of course, after answering that, what do we do about it then?
Wow.
What do we do about it?
It's very hard. It's very hard to actually say. But I always truly believe you have to really be tuned with your body. You have to really try not to poo-poo those things that are starting to change within your body. Right. And a lot of women will say, well, I'm just going to put it down to menopause, or, but other things too are just pain and discomfort. Indigestion is one, heartburn is something, nausea, vomiting, feeling lightheaded, even getting swelling in your legs and your ankles and your feet could be a sign of heart disease. And which woman doesn't have swollen legs at the end of the day, after walking around or whatever? So all these things, you just have to be in tune with this. If the symptoms don't go away, if they just progressively get worse, if you try and take something that you may normally take for maybe the heartburn and it doesn't go away, then you need to seek help. But you have
then
to really
too,
be in tune with it.
we need to find time in our busy schedules to seek help. And then you
Right.
don't want to go to a doctor or whatever if it's nothing. You don't want to waste
Right.
your time. You don't want to be embarrassed.
Always
I
that-
have a
yes,
little
yes.
something, and it's
Right.
yeah.
I think
it's difficult.
what probably happens often too is you do go and they say it's nothing.
Right.
And
That's
then
true.
you go back, and the next thing that happens, it's probably nothing.
Mm-hmm.
You know what I mean?
So
And
it
that
becomes
kind of has a
frustrating.
cycle.
Yeah.
Right.
Yeah.
I mean, how many times has a woman been to the emergency room and has been having a heart attack, and they've just said, well, it's just indigestion? That's,
Sure,
Because
sure.
they say
We've
you
heard
can't
those
possibly be
stories.
having a heart attack.
Yeah.
Because maybe you're only 45 years old. You can't possibly be
Yes.
having a heart attack. So, yeah. So, but yes, so a plaque itself is usually made up of cholesterol and fats and other substances. And what estrogen actually does is it protects you basically in its buildup. So it helps to maintain, because our blood vessels in women are smaller, so it helps to maintain the flexibility of blood vessels. So the blood can pump through easily.
I see.
It helps to decrease the production of cholesterol from the liver. It helps to protect, when the diet that you have, it helps to clear, some of the bad fats and helps to improve the good fats from the liver.
Wow.
So this is what estrogen does for you.
Good old estrogen. Wow.
Good old estrogen.
Yeah.
Yes.
So again, it helps to relax your blood vessels. It also helps to reduce inflammation within the blood vessels too, because the plaque can only adhere to your blood vessel if there's a damage in the blood vessel wall. So if there's any inflammatory things going on, it can't actually attach. So estrogen helps to reduce inflammation also.
Wow.
So,
okay.
all these things, this is what estrogen does for you. So this is why you get where, cardiovascular issues really start to skyrocket once you hit menopause. Once you've lost that protection of the estrogen, this is when things start to really ramp up, which is usually around the age of 50, 55. In men, it's much younger. It's like 45.
Wow.
So that's how estrogen, estrogen is good.
So
It's all good.
so here's what I'm wondering though. If I were to go to a doctor, I don't really go to doctors, but
You must know something we don't.
if I were to go to, let's say, a cardiologist or heart doctor, if I'm now 63 years old, should he be speaking to me in a different way than he would have spoken to me if I was 43 years old?
He should be
Like, would that
he should
screening
be-
or conversation be any different?
It wouldn't be any different. It should be the same. He should actually be speaking to you at 45 or 40 about the things that you need to do to protect your heart. It shouldn't just be when you hit menopause that you are, you're discussing these things. Remember what I said? Cardiovascular disease, CDC has said 6% of women over the age of 20 have started to show signs. And I was looking at screening tests, like blood tests, like for the cholesterol and that. And I was actually shocked to see that you should actually be testing your children when they're starting to turn teenagers, 11 and 12. They should be having a baseline cholesterol test. When they're, and then they repeat it every 5 years. And that's something that should be thought of from childhood. So, which kind of shocked me. I didn't even know that.
Are these new guidelines coming out from the CDC? Well, I know I was going to say coming out from the CDC. Right now, there's nonsense coming out from the CDC.
Is there even
there's
a
nothing
CDC
coming
anymore?
out. Yeah.
Is there?
Yeah, which is a little scary. But
Right.
I thought that a young person, like a teenager or adolescent, should get tested for cholesterol when they have these familial hypercholesterolemia type issues, genetic stuff and what have you.
Right.
But there are some people saying that everyone should get a
It should be
baseline
earlier than that,
just to
right?
see,
Because
yeah.
it's not. Yeah, because the other risk factors are things like obesity and diabetes too,
And our
some
weights
of
are
these
going
things,
up at younger
and our
ages.
weights are going up, absolutely. So it's not just genetics anymore. It's hugely about lifestyle. Kids smoke, kids drink, kids teenagers
Yeah.
do all these things. So these are the things and they have sedentary lifestyles. They're just sitting in front of the computer playing games. So they're not out there running around anymore like they
Yeah.
used to. So, these are all risk factors for having cardiovascular disease. So it's not just about the genetics anymore. So
That's pretty scary.
it is, yes. It is very
But
much so.
it also tells me that patients should be more advocates for their own health and information. And I know that sounds cliche and all, but here we're listening to, if I'm a 63 or postmenopausal, now I'm in menopause, I need to be going into the doctor and saying, like, should I do anything different now? Are there different tests that you should look at for me in addition to the cholesterol or regular EKG? Do you need to take like a better look at the heart or
Right.
at my vessels or things? You hear about all of these different kind of studies and what have you, like new blood tests that people
Right.
take. I know I heard about that. What is that? Lipoprotein A.
What's that?
So, some of the things you would do on a regular basis when you go for your routine exams, the basic things are really just is the blood work, the whole lipid profile. You're measuring your LDL, your HDL. The LDL is the bad, the HDL is the good. Cholesterol is bad. Triglycerides are bad too if they're too high. There's always cutoffs for the best things. And the lipoprotein A is a type of LDL, which is a bad cholesterol. That is doesn't have as much treatment to reduce it like the other LDLs. So that's the thing with the lipoprotein, and it really is in 90% of people it's genetically determined. So you have to be careful if your lipoprotein A is high, because there's not a lot of treatment to get it down. So it's really trying to mitigate the problems doing other things like his lifestyle changes and stuff like that. So
So that's a
but other-
new. That's a new.
it's not new, but it's not a lot of people know about it.
Okay.
So I think they do it more when you have family history of people with sudden cardiac deaths or
I see.
heart disease.
Or
I think
early
they-
cardiac death.
early
Yeah,
cardiac
something like
death,
that.
Right. I think they look at that more carefully in people with strong family history of cardiovascular disease. So it's not new, but it is something that should be considered if you do have strong family history of cardiovascular disease.
And that's with or without being menopausal or not.
yes,
If you have that strong family history, that might be another component of testing.
Right, exactly. So other things, when you start to hit 40, 50, you're going to get baseline EKGs. If you're having some symptoms, they may give you what they call a stress test, which is when they put you on a treadmill to see how your heart reacts to stress, basically.
Yeah, exercise.
And depending on the other things they look at are inflammatory processes or things like thyroid disease. If you have things like sarcoid, lupus, they might look at you a little bit more closely, because all of those conditions are stressors, and things that stress you also can cause cardiovascular disease or add to the risk factors as part of the risk factors. So depending on what kind of other chronic diseases you may have, they may start to look at you a little bit more closely, a little younger. Yeah. Mm-hmm.
Okay. I don't know if you're going to be able to answer this, but this question is plaguing me over here. Okay, so the question broadly is, how do you know that you have a good doctor?
Oh, God.
Right? I mean, how do you know, like, I know there's certain things where you really good doctors would say, if a doctor does this, run the other way. There are some things, right? Or if your doctor doesn't do this, run the other way. So I know there's some thing on this on the spectrum where you would say, yes, do this, run. So can you find a point, a point on the spectrum to say, in terms of menopause, and we're speaking to people who have ovaries and who experience these things, where you can say, okay, do all your disclaimers, that if they don't check you for this, or if they say this when you present this way, find another doctor.
I have a couple of ideas about that. First of all, Ange, you and I both know what makes for a good therapist or a counselor, because we've had a lot of experience with that, right?
Yes.
And we kind of know some of the things that would be red flags and make us run from them. So people who listen to you,
right?
People who are approachable,
right? People
that you don't have a problem telling the truth to, even if it's embarrassing,
right?
As an anesthesiologist, or
they don't have kind of a package response,
a bias,
or biases, all of those things. Yes.
I say to my patients, if you got to tell the truth to anybody, it should be me.
Right. Right.
So it's all a matter of like that trust thing, right?
I see. Okay.
But the other thing that's really big now, I see it on social media, I hear it in the news, and unfortunately I hear it from patients. Medical gaslighting. When patients go in and say, Doc, I've had this pain for a couple of days. It's nothing. You don't really have pain.
Yeah.
That's not really a pain. Or, so you'll get the sense of when someone is listening to you, even in the era of we have only 11 minutes to see a patient. We only have a quick time to examine a patient, and very often patients feel like we're rushing them or cutting them off, not with me per se, but with other primary care doctors per se, But I'm saying that feeling, coupled with, you have to have some knowledge about some of the guidelines. For example, at 45 years old now, people recommend colonoscopies for everybody. If you have a strong family history of GI cancers, then it would be sooner. You're 46 years old. Is your doctor recommending you get a colonoscopy? You should be getting yearly mammograms. That's Dr. Otway's realm. Right. Is your doctor recommending you get or asking you about your mammograms? Or so those are the things. It's like, is she missing something? I remember years ago, my mom had an internist, years, loved this lady. We made her stop going to this doctor because she would not follow the regular guidelines.
Oh, wow.
It's like, doesn't she care about this? Doesn't she care? When is she going to order this? When is she going to order this? And it was like, this lady is not practicing recognized good medicine. Right. But mom loved her. So it's a combination of that feeling of being heard and respected in your personhood, and not medical gaslighting telling you your symptoms are not important. And then also following what you have some sense of being the national standards and the guidelines and things like that. And somebody that isn't defensive when you speak up and ask questions.
Yes, exactly.
What were you going to say, Dr. Toni?
I think that, back in the day, I would say, I hate these people that come in with their Google searches. But
Dr. Google.
Another good, I know, but I think in this day and age when it's so easy to look up what are the standards these days. I think you have to do a little bit of research for yourself to see, is my physician doing this for me at my age, or I hate to say it, but I think people have to look up this stuff to be advocates for themselves these days, because, and the other thing too is there's so much for one doctor to have to know, especially if you're something like family medicine or internist, or not the specialties, but there's so many different things out there now that they have to understand and learn, that sometimes it shouldn't hurt for you to bring in, well, in my condition, I see that they have this test out now. Do you think maybe, I don't think, like you said, a doctor shouldn't be defensive when a patient comes to them and asks them a question about a test that they may not have started them, or a medication that might be out there now that may work for them better. And I think it's the way of, it's the way of the world now, is you have to use, to be an advocate for yourself, you have to use what's out there, your resources to find out information. And unfortunately, Google is one of them. So, the internet is one of them. So I think you have to, because I also think that we are also finding out more and more about the biases that people have against people of color. So even more so, you've got to be an advocate for yourself. You have to question, and you have to do your own research, and don't be afraid to do it.
Yeah. In the time we have left, so let's just say now we know what to look for or what to think about when we go to our doctors in terms of the cardiovascular system, and we're in menopause now. Let's just say we do have heart disease. Now, we don't know if it's caused from our lack of estrogen by virtue of our being in menopause. We don't know if it's from all the pizza that I love to eat on a regular basis and my sedentary lifestyle. Right. Would the treatment for menopause-related heart changes be any different, let's say, than other high cholesterol from other causes, let's say? Or heart disease from other causes?
Well, I think when we talk about menopause and heart disease, I think if you are suffering from menopausal symptoms, hormone replacement therapy is one of the best things out there right now. And it helps, it really does help with cardiovascular disease as well. Hormone replacement therapy helps with your weight, less weight gain, less male pattern weight gain. It helps to reduce your blood pressure, helps to keep your blood vessels flexible, and it helps to keep, if you're a diabetic, it helps to keep your fasting glucose down, and helps to increase your insulin use, and all these things are good with hormone replacement therapy. But the problem is the timing. There's this thing out called now the timing hypothesis, that estrogen, the use of, or the replacing of estrogen, is more helpful early when the estrogen receptors are still active. And the attack on the blood vessels is not as severe. So it's much better if you're going to start hormone replacement therapy to start it as close to your menopausal time, as opposed to being like 5 or 10 years out. 5 or 10 years out, you're really not getting the effects of the hormone replacement therapy.
Wow.
So along with that, it's like anything else. It's lifestyle change. It's exercise. It's changing your diet. It's smoking. It's decreasing your smoking, decreasing your alcohol intake, eating well. Eating the rainbow.
Alcohol.
Alcohol decrease.
I'm finished.
It's eating the rainbow. Low saturated fats, low cholesterol.
All I hear right now is wah 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 wah.
All of that good stuff.
But yeah.
And you know, getting your regular checkups, your blood pressure, your cholesterol check, all these kind of things. So it's always about prevention and trying to change your lifestyle modifications, diet and exercise, and don't be afraid to use the medications that they may want to put you on.
Yeah, I do see that a lot. People say, I don't want to start taking medicines. I don't like taking this. Like, well, you started getting heart disease.
Right.
You know.
And if you're not going to make the lifestyle changes that may reduce you having to take these medications, then you need to take the medications.
Sure.
So.
Anyone feeling convicted right now?
Oh my gosh. It's like, yeesh. I'm wondering if that lifestyle modification, can it come in a pill?
Oh, I know.
You know? I promise I'll take it every day.
Yeah, I wish.
Wow. Oh my gosh. This was so wonderful, Dr. Toni. A lot of food for thought.
Yep, a lot. Everything is all prevention, modification, and be aware. That's all. That's what you need to do.
And I have a couple of appointments coming up, so I know that my language is going to change a little bit based on just what we're talking about.
Right. Okay. Good.
Excellent.
Oh, thank you. So
Thank you, Dr.
I know
Toni.
we're going to see you again with some other organ systems and other effects of low estrogen and menopause and all of that. So I'm really looking forward to that.
Okay, great.
Thank you so
All right,
much.
well,
Good
thank
to
you
have
very
you
much.
again.
All right. Well,
You're like
I'll
a
say,
regular now.
Yeah. That's wonderful. So this has been another episode of Black Boomer Besties from Brooklyn.
Brooklyn.